Hi, Dr. Randy Grill, nursing home dentist, here for a quick update on xerostomia or dry mouth. Saliva is to the mouth what oil is to an engine. So let's go by some of the causes. Aging, just aging process creates hyposalivary glands. Has a fancy name, over 400 medications, alcohol rinses. Pop have a pH of 2, as low as 2 to 3. Water is pH of 7 and battery acid is 1, so pop is near battery acid. That's why you can drop a tooth in Coke and have it dissolve in a day or two. Many kids do that in grade school. Dehydration from drinking too much coffee, tea, and pop instead of water. Acid reflux, cough drops, especially menthol, burn the tissues. Mouth breathing, lemon drops, pooling food as we lose muscle function orally as we get older. Oftentimes that pooling food will dry out the mouth. It's also a symptom of lost muscle function. Mouth breathing, chemicals in whiteners, sensitive toothpaste, and tartar control use a chemical called pyrophosphate. That's Latin for fire acid. So there are many causes, and we can't really change the causes. Most of the meds are life-saving meds, so we don't really have much fudge room there. And so we go on to the results right now. Results. Oftentimes decay is unstoppable and can within 3 to 6 months just devour a mouth from no saliva, because all the bacteria does is eat carbohydrates, the sugar in your saliva. Food sticks on there and it does that and it secretes acid. Well, when you've got lots of saliva, it dilutes the acid and the teeth don't dissolve. And the same thing happens with gum disease. So when the mouth dries out and you've got teeth, it devastates the mouth quickly. And it also, a dry mouth can be painful. Tongue and oral tissues stick to the mouth, and some speech difficulties are actually from a dry mouth and not a stroke. Now, the speech pathologists do therapy thinking it's from a stroke, but it's actually from a dry mouth, because oil is to an engine as saliva is to the mouth. It doesn't allow the mouth and the tongue lubrication to get around. It won't allow dentures to stay up. The upper gets suction like putting water in between two pieces of glass. You don't have that there, and the glass just comes right apart. Well, that's what happens with that upper denture. And the tongue sticks to the lower denture and kicks it out. Some of the results, more results, are painful. Chapped lips, corners of the mouth are very irritated. It even can cause failure to thrive and depression. So let's go over some of the over-the-counter aids and solutions. There's real no solution to hyposalivary gland excretion or xerostomia. All we can do is manage it. And so some of the things, I'm just going to read off quickly and then show you some things. Don't use alcohol mouth rinses. Use alcohol-free mouth rinses. I happen to like, personally, TheraBreath. It is for dry mouth, but it's also for cigar smokers, and I am having a cigar occasionally. It's very good. Don't drink pop, fruit juices, or high acidic acids, but when you do, drink them only at meals, because that helps get the damage away from the teeth and the mouth. No cough drops or lemon drops unless sugar-free. Sugar-free in too many quantities can cause diarrhea. Use dry mouth lozenges. I love, Thayer's has some. TheraBreath, you have to get this online. I haven't found it in any stores. Walmart, CVS, Walgreens, the pharmacies carry it, but you may have to get these little breath mints online, and they are great for dry mouth. They're made for dry mouth. So are Thayer's. Cough drop, sugarless candies, only when you can't find something specifically made for dry mouth. There are gums. Trident, and I have to buy these online. And see, these are over the counter. I can't write prescriptions for them, but if a family wants to help one of their loved ones that has a dry mouth, these are some of the things that will help you. Trident Extra, and it's spelled Xtra. It has recaldent in it, which helps with tooth decay. Now, if they have dentures, then you need to use Freedent, but that will stimulate flow and is much better. These gums, especially the xylitol gums or the Extra, not the EX, that's by a different brand. This is by Trident. And one of the things I've found, especially for my comatose patients or those elderly people, and you have to get approval from the Director of Nursing, the DOM, this is a little ultrasonic cold air humidifier. It uses ultrasound, and it just beats to the band. You can put this close to their bed. It has, the light glows quite a bit, but I use this in the wintertime because I'm a mouth breather, and it really helps. We used to have one of those big things that put it out like fogging mosquitoes, but this is perfect for one person, and it won't affect other people if they've got a two-room, but it'll keep it moist around them. If you have a loved one that's in a coma or pretty much not able to move, this is excellent. And you just take that and you just fill a bottle of water. You don't have to take the whole big gallon thing and go down the hall and fill it. So therefore, I really like that. And I got this at CVS, and it's just a little portable. People take it with them to hotel rooms. It plugs in. There's no batteries, and it's excellent. Also, my favorite dry mouth spray instead of cough drops is Biotene moisturizing spray. I own no stock in Biotene, but Biotene was one of the first on the market, really good. Now everybody has an alcohol-free mouth rinse, even Listerine, so you don't have to do this, but try different ones for them. You don't have to get it all at once. Just introduce a little bit at a time, see what they like. They may like the spray more than they do sugar candy. They may like these lozenges from TheraBreath that you have to get online rather than cough drops, but the menthol cough drops are just real difficult in the mouth. There are dry mouth toothpaste like TheraBrush, but these are things that each caregiver should know, and the families are going to have to help. This is beyond what a nursing home can do. I know you pay them a lot of money, but they can't do this kind of thing. You're going to have to help. Make sure you approve that ultrasonic humidifier with the DON or the administrator. And I want to talk a little bit about toothpaste. The kindest toothpaste is AIM, just regular AIM with fluoride. You got to get on your knees at Walmart or CVS or Walgreens or whatever store is in your area to get them, because they're only 99 cents. Actually, I saw it for 88 cents the other day. But if dry mouth is not an issue or you're limited, at least go to AIM. It's an old-fashioned formula, and it's not loaded with all the chemicals that dissolve teeth and erode the mouth. Also, one of my favorites is do not use Vaseline. Whatever you do, it's a petroleum jelly. It's harsh on dry lips. It's easy for me to get at Walmart, but I know everybody else has it. It's a lanolin, which is sheep fat, and it comes in these little tubes. Nursing mothers use it for their nipples when they get sore, and it's called Lansinol, Lansinol. These are solutions that for birthdays, for special presents, they're always a family member that says, oh, what can I do for grandma? And I say grandma because 99% of my patients are female in nursing homes, because 75% of the males die within the first 6 months, according to the national statistics. So help grandma out a little bit, especially if she's got a dry mouth. She's got lots of other challenges. Thank you. This is Dr. Randy Grill, nursing home dentist.